Meeting to order. Welcome to meeting number 64, the House of Commons Standing Committee on Justice and Human Rights, pursuant to order adopted in the House on March 8, 2023. The committee is meeting in public to begin its study of Bill C-295, an act to amend the criminal code, neglect of vulnerable adults. Today's meeting is taking place in hybrid format, pursuant to the House Order of June 23rd, 2022. Members are attending in person and in the room and remotely using the Zoom application. As are all members, including the panelists, I won't go into how to use Zoom or your interpretation functions. I now, in the interest of time, would like to welcome Dr. Fry. Dr. Fry, welcome to our committee, and the floor is yours. You have 5 minutes, and then we'll have questions and answers right after.
Thank you, Chair. I am being, mea culpa. I didn't plug my headset or anything, and so if I may be permitted the indulgence of the committee while I do that. Thank you. Thank you very much, colleagues, for inviting me here to speak on my bill C-295. I think it is an important bill, even though it sounds like a simple bill. It's an important bill because the issue of long-term care is a provincial one. It is not in the Canada Health Act, it's purely provincial jurisdiction. And so the only way that the federal government can have a role is to do something within its jurisdiction, which is the criminal code. And so what this bill is meant to do is to amend sections 24 and 25 of the criminal code to protect vulnerable adults. It extends the definition to vulnerable adults. Currently, Section 24 and 25 deals with child abuse and child negligence. So we are now using it to extend to vulnerable adults. And what the bill does is it puts in some specific definitions. It tells us what a vulnerable adult is. And a vulnerable adult is a person who, by virtue of age, mental, physical illness, or disability, and who is frail, that's meant to be a vulnerable adult. So the ability to take care of that vulnerable adult follows completely through with 24 and 25 of the criminal code with regard to children. I think, why are we doing this? We're doing this because currently the only national standards that we have for long-term care, which is a provincial jurisdiction, and I want to keep stressing that, is a national voluntary set of standards. Everyone should and could try to, etc. There is no mandate for this. And this continued on for a very long time until COVID exposed the vulnerability of that system. As we well know, about 54% of all long-term care facilities are actually run by private sector, many of them not for profit. There are some of them that are church-based sectors, but most of them are just private. And I think what we saw after COVID when we found out that while 3% of people in long-term care facilities got COVID, that actually 43% of them died. So that was really out of whack. It was an overbalance of that. At the same time, while other countries had 41% of people in long-term care facilities getting COVID, in Canada, we actually were the worst. We had about 69% of our seniors getting COVID and dying from it, as we well saw. I think the reason is because we don't have mandated standards. The federal government cannot stand up and mandate standards. It is something the provincial government's going to have to do. And so currently what this bill does is it defines who a vulnerable adult is. It expands the duty for care from a child to a vulnerable adult. And it actually puts in some other definitions. For instance, it defines what a long-term care facility is. And a long-term care facility is where 3 or more people are vulnerable by virtue of, as I said before, age, mental illness, physical illness, disability, etc. And they are not related to the caregiver by blood or marriage. So that rules out somebody who's looking after grandma or grandpa at home. This is about a facility, and there must be 3 or more people in the facility. Now, it defines manager. What is a manager of a long-term care facility? And it defines what a manager is and the duty of that manager, and it defines what that duty is. Failure to perform. If that manager fails to perform a duty to provide the necessity of life and the appropriate care to vulnerable adults, then they would be liable, obviously, as this bill tells you, to certain penalties, a fine or jail time. And it also talks a little bit about what was wrong. Why did COVID expose this problem that we didn't know about before? As a physician, I knew about the problem with long-term care units. I looked after patients in some of these units, and we knew what the problems were. But after what happened with COVID, as you know, the armed forces went in to help in some of these facilities, and their report is scathing. It talks about how, in fact, many of the people in these areas, the cleanliness was lacking, protocols were lacking. Most of the aides who were performing the work to take care of seniors had no formal medical education or healthcare education or training. They were just doing this. They were moving from patient to patient during COVID using the same gloves, the same protective equipment. They did not often wash their hands. And I think those are the things that we saw. And what this bill is striving to do is the Canadian Standards Association has set standards that are very clear for what is required to care for vulnerable adults in these facilities. What this is doing is saying to vulnerable adults, if you don't do it, to managers and owners of these facilities, if you don't do it, you're going to be penalized. It brings in teeth and accountability to something. This is the only way that the federal government can intervene. And I'll leave it there, and I'll be happy to answer any of your questions. Thank you.
Thank you, Dr. Fry. And before we start the round of questions, we're just going to do a quick sound check with Mr. Caputo. So I'll let the clerk do that.
Good afternoon, everybody. I hope that everything's working well now. Thank you for your patience.
Thank you. I got a thumbs up for you.
Sounds good. For our first round, we'll begin with Mr. Van Popta, and we'll go with 5 minutes just because of vote, so if that's okay.
Thank you, Chair. Thank you, Ms. Fry, for being here. Thank you for your private member's bill. We're generally supportive, but it's here at committee for us to work together to make it stronger. But before I get into that, I have a question just more generally. In the 2020 speech from the throne, the federal government made commitments to work with Parliament on the criminal code amendments explicitly to penalize those who neglect seniors. And now here it is, a private member's bill that is being presented. And it's also in Mr. Lemaity's mandate letter that he should, I just want to get the wording correct here, continue to work with ministers of seniors to strengthen Canada's approach to elder abuse by finalizing some legislation. So why is it being left up to a private member's bill to bring this important legislation forward?
Well, somebody had to do it. I mean, as a physician, I saw what had happened. Many of us know that so many and the word vulnerable, meaning they cannot speak out, they have no one to go to bat for them, they weren't allowed to have their family visiting them, etc. It was a needless. I mean, what we see in terms of these long-term care units is facilities is a great deal of negligence and abuse, actual abuse. And so somebody had to bring something forward that would get some teeth in why things are being done, negotiating various things with provinces,
I think we agree that this is important legislation, important initiative, but why isn't the government taking the lead on this? Why isn't it the Attorney General, Minister of Justice doing this?
Well, because when I brought this bill forward, I went to him and I said, I'm bringing this bill forward. Do you have a problem with it? And he said, no. In fact, I think that we think it's a good idea. Would you do this? Continue. Go ahead and do it.
So why isn't he leading the charge? And I note that, like, we all voted in favor at second reading to bring it to committee, but Mr. Lametti did not vote. Presumably he wasn't in the House that day, but he chose not to vote remotely either.
I can't answer for Mr. Lametti, I'm sorry.
All right, fair enough. So you highlighted that there's a new definition for long-term care facility and a definition for manager, but there's no definition in Bill C-295 for owner. Yet owners, whatever that might be, whoever that might be, could be criminally charged. So wouldn't your legislation be improved by having a clear and concise definition of who an owner is of a care facility.
Well, if you look at the definition in the bill, it says that a manager in respect of a long-term care facility means a person who is responsible for hiring or scheduling staff who provide care, purchasing or directing the purchase of medical and other supplies, directing the daily operations of the facility, including planning and coordinating the provision of care. It gives an extensive list of supervising all of the care, monitoring the implementation of policies and protocols.
I only have 5 minutes, and that's
the owner usually hires a manager.
You're
to do
reciting,
this
you're
day-to-day
reciting
work.
the definition of manager. But what is the definition of an owner, particularly in a privately owned setting, whether it's for-profit or not-for-profit? Sometimes corporate structures are complex, where one company owns the building, but contracts it out to another to operate it, who then might have subcontracts with other private companies that operate some part of it. So who's the owner in that?
Well,
example?
in that instance, it may be the company, it may be an individual person who owns it. The point is that if that person also happens to be doing these duties, managing the care, then that person is defined as a manager as well as an owner.
Well, then
Many
that would-
owners
then
are
that
arm's
person would-
length.
that
They don't
person-
know what the managers are doing.
That person would then fall within the definition
Yeah.
of manager. My question is, why isn't there a definition of owner when an owner, whoever that might be, could be charged criminally under this act? Like, we're trying to improve the legislation. Where's the definition of owner?
I think that what we didn't want to do was to say it's an owner. Let's say the owner is a company and they just hire people to do the work and they have clear guidelines, but they don't actually do the day-to-day care. And this person who is managing it is falling by the wayside. We didn't want to reach out and say, just because you own it, you're responsible. It would have to be the person doing the work of the day-to-day care and management that we're trying to get after.
I'll just leave it at that. I would only note for the record that there is no definition of owner, so I don't know how somebody could be charged as an owner. I want to now reflect on the definition of manager. It, on the other hand, is very, very broad, and it includes even the person who is doing the scheduling of other workers. And I've spoken to a scheduler at a care facility, and this is a big, stressful job, particularly when there's a shortage of skilled workers. Now, would that person who's doing her best, his or her best, to make sure that there's full staffing for every shift, would that person be criminally negligent if there were something tragic to happen on the floor that day?
Well, I think
Very
the
quickly,
bottom
Dr.
line is that when something tragic happens, one would go back and we would find out why. And if the person is taken to court, they would have to say, I just couldn't find staff. I couldn't, whatever their extenuating circumstances are, they would be able to use that to find a reason for. Hospitals have lack of staff all the time.
Thank you, Mr. Popta. Next, we'll go to Ms. Briard. Ms. Briard for 5 minutes.
Merci beaucoup, monsieur.
Thank you very much, Chair. Can I continue? I'll speak in French. First of all, thank you for being here with us today for the tabling of this bill. I had the opportunity of working with you in committee on assisted euthanasia, and I think that this bill is another commitment that we're showing to the more vulnerable people in our society. We know that COVID highlighted concerning living conditions of our seniors and other people who are living in long-term care facilities, and this can happen anywhere in Canada. Last month in my region in Sherbrooke, residents of a facility had to be evacuated because there was suspicion of negligence. And over the years, I have heard all sorts of stories. There was a patient, for example, who stayed in the personnel lift during the entire break of a staff member. So I want to know if you believe that this bill will be a first step to establish a stronger legal framework with respect to elder abuse and abuse against vulnerable people.
Thank you for pointing that out. But it was something that had to happen because we have no idea if another pandemic will hit us tomorrow, and we don't want to be scrambling around once again. We want to be able to have some protocols, some clear guidelines in place, and accountability, because right now, with the national guidelines that we have with provinces, those guidelines are voluntary. And what, as the executive director of the Ontario Health Coalition said, no one was charged. No one was held responsible for what went on in COVID in long-term care centers. So that this is something that will take a first step in the meantime, helping people to be accountable. The Canadian Standards Association recently set new guidelines. And so if we have that kind of body naming guidelines, and we know what those guidelines are, people who fail to meet those guidelines, if the provinces don't want to do anything about it, the federal government can hold them responsible in the interim. But hopefully, the next step would be to work with provinces to find a way to build in ways of getting provinces to have clear guidelines, to enforce those guidelines themselves locally.
Vous croyez donc que le projet...
So do you think that this bill respects the separation of jurisdiction between the federal and the provinces? Do you think that this bill respects the separation of jurisdiction between the federal and the provinces?
I think it does, because even in the Canada Health Act, and everyone talks about the Canada Health Act, long-term care facilities are not included in the Canada Health Act. They're not part of it. So the federal government cannot use the Canada Health Act to discuss long-term care. They have to do it on a one-on-one negotiating basis with provinces and saying, here are some of the things. In the interim, what it can do is use the criminal code to make people accountable and responsible for that lack of duty to care.
Dans l'élaboration...
When you were formulating this bill, did you go and meet different people involved? Did you go to the long-term care facilities, for example?
Yes, I did. I spent a lot of time in long-term care facilities when I was practicing medicine for 20 years, and I saw it, and the heartbreak of patients complaining about the care that they got or didn't get, the abuse that they got or didn't get, that they got from a lot of caregivers, was something that all I could do was complain. I couldn't do anything about it. They also had to be quiet and say nothing in case they get treated even worse. So it was that position of people in trust and authority who could penalize you if you dared to say something happened here that I was unhappy, or if your family manages to complain about something. So this is, I'm a member of Parliament now, and I could use that ability to deal with something. Dealing with it prior to COVID meant that the public would want to know what I was talking about. COVID exposed us all, and as we saw, the Armed Forces Task Force made some very clear reports, which is almost reads like a horror story about what was lacking in these long-term care facilities.
Thank you, Ms. Briard. Next, we'll go to Ms. LaRoche for 5 minutes.
Merci beaucoup, monsieur.
Thank you very much, Chair. Ms. Fry, thank you very much for being here today as a witness on this bill, which is quite sensitive to me. You shared your experience as a doctor, and before I was a member of Parliament, I was a project manager to raise awareness on abuse and with elders, because in Quebec, the senior secretariat decided to have a bill to fight against elder abuse. So, as you can understand, this topic is quite close to me, to my heart, and because I lived this experience quite close, and I was in collaboration with many stakeholders. We had concerted interventions where we brought the communities, the health sector together, alternative justice organization, even the police. We gave ourselves tools where we could resort to litigation. So when I hear you, I feel like we have different realities between Quebec and the rest of Canada. Let me explain. For example, in Quebec, we have a law or rather a bill in Quebec against elder abuse. And then our long-term care facilities are mostly public facilities. We are 26% private against 46% in the rest of Canada. So that difference is quite glaring. So I want you to, since you talked about respecting the different jurisdictions, I want to know how can we make sure that this bill will indeed respect these jurisdictions, because including this in the criminal code, given that it would be a federal jurisdiction, I have a bit of concern, but I really want you to explain further about the distinguishing between the different jurisdictions, because in Quebec, long-term care facilities are under the provincial government.
That's an important question. Thank you for it. I think one of the things that we saw was that during COVID, there were 13 different jurisdictions with regard to public health, with regard to protocols, with regard to everything. And the federal government did not have that ability to say to everyone, let's play by one plan, let's do it one way so that everyone would be following the same rules, because the federal government couldn't do that. And I think what we saw was that because of the spottiness in different provinces of the way things are run, the criminal code applies to individuals, persons, and facilities. So this is not, if Quebec has great laws, great protocols, great legislation, it is purely for Quebec. But we are talking about across the country, and pandemics don't respect provincial jurisdictions. Pandemics happen, and our duty is to protect people.
Yes, of course, we want to protect people. But to protect people, as I said, since it's under the social services and healthcare systems, I, of course, don't want to undermine what happened, but I want to remind you that the armed forces talked about highlighting the fact that there was a shortage in manpower, and we need resources to implement the rules that we want to put in place. We need staff to take care of people, and that requires extra money. So that is why it's important to transfer financial resources. It's the Canadian Armed Forces that mentioned this in their report. So I want to conclude with another comment. In your definitions, you did not indicate that these facilities are under provincial jurisdiction. So maybe you have to look at that, because yes, we're ready to talk about it and we're ready to seek ways of improving the situation. And here it's very prescriptive in terms of what long-term care facilities should be, but it excludes also the definition of a senior who decides to go to a long-term care facility. So these are excluded here, and maybe we should talk more about that in your bill.
I don't
Thank you, Ms.
know.
LaRoche. Dr. Fry, very briefly, 10 seconds.
No idea. I don't think I understood your question very well. But perhaps we can get to it in another round. Thank you.
Thank you. Next, we'll go to Mr. Garrison for 5 minutes.
Thank you very much, Mr. Chair, and thank you very much to Dr. Fry for being here with us today and for introducing this bill. I think the members of the committee all understand that the criminal code is a blunt instrument and a limited instrument, but it is an instrument for getting at the crisis that we saw during COVID. With respect to my colleague from the bloc, though, I think we saw a different problem than a jurisdictional problem, and that was the ownership.
Désolé, problème de traduction.
Translation problem? Could translation just, we're going to pause you for a second there. Just say a few words and see if
Is now functioning. Okay. So I'll back up just slightly. I think that, respect to my bloc colleague who talked about jurisdiction as the difference, what I saw was something different. In the first 15 months of COVID, we had 56,000 residents of long-term care in Canada who got COVID, and 22,000 staff, and there were about 14,000 deaths among the residents, and that's a rate of about 20% of those who were infected. But the record for private nonprofit facilities was much, much worse. So there were three times as many infections, 2 times as many staff infections per bed, and the resident deaths were at a significantly higher rate, sometimes between 30 and 40% of those who were infected, when the general rate was somewhere around 20%. So it seems to me that the distinction here, that the facts support, is not about whose jurisdiction, but about whose ownership of those facilities. And I just wonder whether you would agree with me that's a significant problem.
Absolutely, I agree with you, yes. I think that is a very important distinction that you're making. If you look at Ontario, for example, people who were in a long-term facility during COVID were 13 times more likely to get infected and die than people who were the same age living in a community. And I think we saw that the problem was with the long-term care facilities and not necessarily with the age alone.
But also, the difference between the public and non-for-profit and the for-profit facilities was quite significant.
And we know that in some provinces there are a huge number of not-for-profit. I mean, that's what we're trying to say, that it's different in every province, and we're using this blunt instrument to make people accountable and responsible.
Of course, as a New Democrat, I'm one of those who thinks we should try to eliminate the for-profit long-term care, and that's why in our confidence and supply agreement with the government, we got a commitment for the introduction of a Safe Long-Term Care Act, which would correct that omission from the Health Care Act. And I wondered what you thought about a separate standalone Safe Long-Term Care Act.
Well, it cannot be under the Canada Health Act because it never was. So one would have to write it in to the Canada Health Act. It would be very difficult, I would think, to open up the Canada Health Act and write in new things. So one would have to do this as a separate Long-Term Care Act, yes.
Okay. In your act, you have a very broad definition of managers, and one of the concerns that I've heard is that a lot of the frontline workers were working in constrained conditions where the owners and the effective decision makers restricted the financial resources available, so they couldn't hire more staff, they couldn't access more cleaning materials. And so the concern has been raised that your broad definition of manager might include some people who are trying very hard to deliver the care, but were constrained by the owners and the financial decision makers in those institutions.
I think if you read the definition, it talks about people who are hiring and scheduling staff. It talks about the daily operations. It talks about people who are supervising staff. It talks about controlling and evaluating the quality of care. It talks about monitoring the effective implementation. So it really doesn't talk about staff who are obeying whatever orders they were given. And we heard from the report from the task force, the 4th Battalion Task Force, is that money was one big reason. Saving money was a big reason for not doing things. But there was also hiring of staff who were not necessarily qualified, who were inexperienced. And then there was a factor that many of the staff were afraid. They were afraid to deal with people who had COVID. They were scared they would get it. And so, again, we have a whole bunch of things that, as you say, a Long-Term Care Act would address: certification, registration of who should be working in such facilities.
But surely there's a difference between a manager whose job is to schedule staff and even hire staff, who knows there's a bigger need for staff, but isn't given the resources to do that. So my concern is about those middle-level managers being unfortunately captured in your act, and perhaps that we need to move the definition so it really only captures those who are making those financial decisions that are crucial to care.
But I don't think it's only financial decisions. I think even if there are protocols, we know that in the report that there were some people who were managing the daily operations who didn't follow protocols. And so it isn't only about who pays for the facility and who wants to save money. It's also about people who don't necessarily follow all the COVID protocols that they had, or who wanted to, or who weren't able to get the staff to be trained or had trained staff under them. So somebody has to be responsible for that daily care to provide the necessities of life to people under their care. I mean, we're specifically talking about COVID, but I think if you look at hospitals right now are constrained by the idea that they don't have caregivers. They don't have healthcare professionals. We're trying to hire people. Burnout is a big issue, and you couldn't find qualified people to work in these spaces. Besides, it didn't pay them enough.
Dr. Fry, we're going to have to
Thank you.
Next, we'll continue with 5-minute round. The next one would have been 5 minutes anyways. I don't see the bells ringing, so I think we probably are not having a vote, so we'll continue the next round. So, Mr. Brock for 5 minutes.
Thank you. Thank you, Ms. Fry, for your advocacy on this bill. I was just thinking about another line of questioning that I wanted to pursue with you, and it's in relation to law enforcement generally. I don't know if you were aware of this, but my previous background was in Crown prosecutions, and I can inform you that, and my jurisdiction has a number of homes that would cater to vulnerable adults, and I've heard numerous tales of abuses, and on a piecemeal basis, various social workers or parental workers would be charged with the current legislation. I know that, or the existing regime, I should say, under the criminal code, and I know that your bill takes it one step further and takes a look at actual managers and potential owners. But the impression I had always had, and I'm looking at the pandemic and all of the examples of abuse from coast to coast to coast, there still appears to be a general reluctance with policing to lay criminal code charges in relation to any extreme cases of abuse where the evidence is there, witnesses have come forward, sometimes pictures were taken, so that the police had the ample tools before them, yet chose not to pursue any sort of relief under the criminal code. So my question to you is very, very simple. In terms of the stakeholders that you may have consulted with when you started working on drafting this bill, did you take a look at policing in general and ask them that specific question as to why there has been and continues to be a reluctance to hold individuals accountable for this extreme abuse to our vulnerable members of our population?
I actually did not consult with police, but I do think that your point is extremely well taken. But in the past, the police did not have the definitive definitions and legislation. They had it for child abuse. They could enter and deal with child abuse because it was very clear under sections 24 and 25 of the Criminal Code. Now that we've expanded this, same sections that dealt with child abuse to vulnerable adults, the police now have been given some extra tools within the Criminal Code to be able to move where they possibly couldn't in the past.
So I kind of anticipated that response from you. So I'd like to know how you reconcile that explanation with existing terminology and existing charges and existing sentencing principles already within the criminal code. So let me just give you an example. Under section 215 sub 1 sub C of the criminal code, there already exists a charge of failing to provide the necessaries of life to someone in your care. 217, failing to take reasonable steps to prevent bodily harm when directing another's work. And then the catch-all phrase, criminal negligence, which could certainly fall into numerous cases where I have read and seen abuses during the pandemic. The definition section early on in the criminal code under section 22 defines an organization such as a long-term care provider could be considered a party to an offense. So in your case, owners or managers could be held criminally liable in the same fashion as the principal perpetrator of the actual abuse. So we have that already in the code. We already have sentencing provisions under 718 sub 2 sub A that speaks about wherever you have elder abuse, it could be viewed as an aggravating factor that where there's evidence that the offense had a significant impact on the victim, considering their age and other personal circumstances, including their health and financial situation. So again, it goes back to my earlier question. The police already have the tools, with the exception of perhaps defining in your bill the manager component and the owner component. How do you feel your bill provides additional resources to the police that they already do not have?
Well, again, we have the whole aggravating factor in sentencing, as you well know. But the bottom line is that it is more specific. It is very specific about the facility. And in other words, it's not if you're looking after grandma and you have been abusing her. This is about facilities per se, people who own and operate those facilities. And so it is very specific so that the police can specifically look after those issues. I think the other was more general and didn't give the police the tools they needed.
I'd let her
We'll have to
answer.
continue this discussion some other time.
Thank you, Dr. Fry.
Sure.
Thank you, Mr. Brock. We'll next go to 5 minutes.
Thank you, Dr. Fry, for bringing this bill forward. I'd like to start with something I noticed. There is no definition of elder abuse in the bill. Would you be open to adding that? And if so, in your opinion, what would define elder abuse?
Well, first and foremost, I think the bill does pertain to abuse, negligence, etc., in a facility. Remember, this is about a facility, and a facility was defined in this bill that I'm doing here. I think what we wanted to do is to steer clear of elder abuse that may happen generally within a family, by anyone else who is caring for a person, again, by virtue of marriage and or blood. And there are other parts of the criminal code that could deal with clear elder abuse. This is about in a facility that was specifically designed to care for, provide the necessity of life of a person who is a vulnerable adult.
In your opinion, since this is a matter of urgency, and we wanted to act as soon as possible, a private member's bill was the way to do this. Can you explain what the urgency is in bringing it forward in this manner?
I think the urgency is that pandemics are with us because of global travel, because we are very mobile as individuals. We go from place to place. Pandemics will happen. Right now, it's a respiratory pandemic. It was COVID, and it was a respiratory syncytial virus, and it was a bunch of respiratory things. It could be others. It could be bloodborne diseases. It could be spread through, fecal matter. It could be spread through bloodborne. It could be, pandemics are now going to be a thing of reality. And the World Health Organization have flagged that this is a reality. And we know that people who are in facilities amongst other people who may be sick. And the whole idea of transmission from one person to another within a facility is something we have to think about, because contagious diseases spread in crowds or in places where there are many people gathered together, such as a long-term care facility.
Perfect. And how would this legislation be better than what exists now, than the status quo?
Well, the status quo didn't work, did it? All of these people who died needlessly and who were abused and neglected, COVID exposed it all. And so I think now we know that there are some things we must do while we are going to be talking and negotiating with provinces about human resources and about all the other things we have to do. And as Mr. Garrison said, looking at a Long-Term Care Act. Until then, what if a pandemic blows up tomorrow? There has to be something that we can do right now to take care of people who are vulnerable.
And we also know that elder abuse is not well documented here in Canada. There's limited data collection. There's underreporting for many of the factors you mentioned during your testimony. Fear of reprisal. They're just incapable of doing it. They're very vulnerable. How do you think data collection could be improved?
Absolutely. Legislation or criminal code amendments are only one part of a solution to many problems. One of them is obviously going to be data collecting research, a whole bunch of other things, education, allowing people to know what their rights are, etc. So this is one piece. This is not a catch-all. This is not going to stop everything from happening, but it is one piece. And, again, in the criminal code, we cannot put down something such as research and development because that's a totally different thing. But I do think research data collection is very important. If you can't identify the problem, how can you prevent it?
There keeps, there's mention of these concerns that keep coming up that managers or owners are going to have regarding this bill, that there's a lack of people to work for them, that it's going to discourage people for working from them. But we also know that long-term care homes are the least monitored, and we saw this during the pandemic. It blew up. But it's not like nanny cams didn't catch abuse in the past. So these concerns that the owners and managers have, how would you respond to that?
I think that, owners and managers, if the bottom line for them is profit, if it's cutting back on medications, cutting back on staff, that's a problem. Why do you think a lot of the staff that the report showed were not registered, were not certified? That's because people want to pay them, very little wages. And so they bring in untrained, unqualified people to work. I would say to you that a lot of registered nurses wouldn't work for that kind of money and wouldn't work in a place where they know they were going to be abusing and denying access to protocols and health care to their patients. So these people are free to do whatever they want. And we're trying to stop them from that.
Thank you, Ms. Dillon. Last, we'll go for 2.5-minute rounds, beginning with Ms. LaRoche.
OK, merci beaucoup, monsieur.
Thank you very much, Chair. Very quickly, Ms. Fry, I just want to come back to what I was saying at the end of my first round of questioning. The first thing that is problematic is the fact that we are not mentioning that these facilities are not under provincial jurisdiction. Now, if we have a law that is prescriptive, we want to really know where you get this definition of long-term care facility, and is it in line with the definitions in each province? And my last question, as I was saying first, it is excluding the seniors who, on a voluntary basis, decide to go and live in long-term care facilities. They are not necessarily vulnerable, but they are older. So I really want to have answers to these questions. Thank you.
I think someone who decides to go and live in a long-term care facility obviously needs care. They're obviously unable to provide care for themselves. And I think that may be because they're chronically ill, maybe they're frail. They don't have to be necessarily mentally ill or disabled, but they do have reasons why they can't take care of themselves. So they go there trusting that the people who are running the facility will give them the care that they need. And so we need to protect them from that belief that because they go into a facility, they will get the care they need.
Madame Fry,
Well, you have answered my question about jurisdiction and where its definition comes from in terms of in line with what is defined in the provinces. You also defined clearly what is a manager and highlight the different tasks. Now, when we're talking about the duties of a manager of an owner, we know that these are, I want to remind you that these long-term care facilities in the province of Quebec are clearly defined, so maybe it would not be very clear. Well, I have to say that this bill is rather vague. We have to know what it is involved in terms of facility. Is the full responsibility on the manager or the owner? Or is the responsibility or the accountability only on the employee? So these are the questions that come to mind, and do you have answers to those?
It said very clearly who is going to be responsible in it when it defined who a manager is, what a care facility is and what who are the persons employed on a casual basis are obviously not involved in any of this definition.
Thank you, Dr. Fry. And last to Mr. Garrison for 2.5 minutes.
Thank you very much, Mr. Chair. And once again, on this jurisdiction question, if we look in the first 15 months, there was a privately run and owned facility in Pickering where 35% of those who got COVID died, and there was one in Dorval, privately run and administered, where 35% of those who were infected died. Yet in the public institutions and not-for-profits in both provinces, the death rates for those infected were less than half that rate. So again, I'm going to come back to what the facts show us, that it's probably not a jurisdiction question. It's a general question of COVID and long-term care, but it's also a question of the ownership. So once again, I think you'd probably agree with me on that.
I agree with you on that completely, yes.
So the question then is to identify who's responsible. And with respect, Dr. Fry, when you talk about the managers, it's as if suddenly we have a bunch of managers who are certified healthcare professionals, who are nurses or long-term care professionals, who are suddenly not doing their job. And I find that a little hard to accept as the reason that this happened, because those people are extremely dedicated and work very hard every day. And they have no interest in not doing their job well. The people who had an interest in saving money, to me, are the ones we need to look at for who's responsible for that higher rate of death.
I think, again, what was discovered in the report, that it was not saving money was one of the big reasons. But other reasons were that they had untrained staff who were scared. They were scared to go into rooms with people with COVID because and if they're untrained, they would go in the same paraphernalia, the same protective equipment that they had looking after patient A. They walked into the room with patient B with the same thing because they didn't have staff who were equipped and trained and able to provide the quality of care. And that was, again, we're back to that was because they were being hired because they couldn't pay, RNs, and they couldn't pay people with the kind of training that were needed to provide that care.
And with respect, I think that leads us right back to the question I was talking about, is who made those financial decisions that created that situation. With that, Mr. Chair, I'll conclude my questions.
Thank you for presenting the bill and answering all the questions, and I'm sure we'll have some more witnesses in the coming days and be able to flesh it out and give back a thorough report. So I want to thank you, and now I'm going to suspend for a few minutes while we go in camera to do some... actually, technically adjourn the meeting because the other is a subcommittee meeting. So we will adjourn.